Polio, short for poliomyelitis, is a highly contagious viral infection that primarily affects children and can lead to paralysis or even death. While polio has been largely eradicated in many parts of the world due to widespread vaccination, understanding the disease's causes, symptoms, diagnosis, treatment, and prevention is essential for ongoing public health efforts. Causative agent polio is caused by the poliovirus, which belongs to the enterovirus genus. There are three types of poliovirus. Type 1 WPV1, the most common strain associated with outbreaks. Type 2 WPV2 has been eradicated globally. Type 3 WPV3 last detected in 2012, with eradication efforts ongoing. Transmission poliovirus spreads primarily through fecal-oral route. The virus is often found in the feces of infected individuals. Poor sanitation and hygiene can lead to transmission. Oral route. It can also spread through respiratory droplets from coughing or sneezing, though this is less common. Contaminated food and water. Consuming food or water contaminated with the virus can result in infection. Symptoms: polio can present in several ways, ranging from asymptomatic to severe. Asymptomatic infection. Approximately 72% of infected individuals show no symptoms. Non-paralytic polio. About 24% experience mild symptoms, which may include fever, fatigue, headache, nausea, stiffness in the neck and back, muscle pain. Paralytic polio. In about 1% of cases, the virus affects the nervous system, leading to flaccid paralysis, weakness or paralysis in one or more limbs, often asymmetrical. Respiratory muscle weakness, difficulty breathing, which can be life-threatening. Bulbar polio, affecting the brain stem, leading to difficulties in swallowing, speaking, and breathing. Diagnosis of polio typically involves medical history and physical examination, evaluating symptoms and vaccination history, conducting a neurological examination to assess muscle strength and reflexes. Laboratory tests. Stool samples, testing stool for the presence of poliovirus. Throat swabs can also be used to isolate the virus. Serum tests. Blood tests can help identify antibodies to the poliovirus. Treatment. There is no cure for polio, and treatment primarily focuses on supportive care to alleviate symptoms and manage complications. Supportive care. Pain relief. Over-the-counter pain relievers like acetaminophen or ibuprofen for muscle pain. Physical therapy. Rehabilitation exercises to improve strength and function. Respiratory support. In severe cases, mechanical ventilation may be necessary to assist breathing. Management of complications. Addressing issues related to paralysis, such as mobility aids and assisted devices. Prognosis. The prognosis for individuals with polio varies based on the severity of the infection. Many who recover from non-paralytic polio do so without long-term complications. Those with paralytic polio may experience permanent muscle weakness or paralysis, and some may develop post-polio syndrome (PPS) later in life, characterized by new muscle weakness and fatigue. Prevention. Vaccination is the most effective way to prevent polio. There are two types of vaccines. Inactivated poliovirus vaccine type IPV. A killed virus vaccine administered via injection. IPV is the standard in many developed countries and provides strong immunity. Oral poliovirus vaccine OPV. A live attenuated vaccine administered early. OPV is effective and easy to administer, making it ideal for mass immunization campaigns. Global eradication efforts. Thanks to vaccination campaigns, polio has been eradicated in most parts of the world. The Global Polio Eradication Initiative (GPI) was established in 1988, resulting in a dramatic decrease in polio cases. However, the virus still exists in some regions, notably in parts of Africa and South Asia. Continued vaccination efforts and surveillance are crucial to prevent outbreaks and achieve global eradication. Conclusion: polio remains a significant public health concern in areas where vaccination coverage is insufficient. Understanding the disease, its transmission, and the importance of vaccination is vital for preventing polio and protecting future generations. If you have any questions about vaccination or polio symptoms, consulting a healthcare professional is essential.